Hello and welcome to Health Series with Nurse Faustina. Today's topic will be talking about how to take care of the umbilical stump of a baby after birth, right? Because when the umbilical stump is being taken care of, it will enhance healing and also prevent infection. And these are the information you need to have before embarking on it or to have an effective end result, right? First of all, you need to keep it clean. Keeping it clean by washing it off gently with plain water and soft clothes, because when it is roughly handled, it tends to be severed and might eventually pull off, and it is not a good uh, condition, right? Another one is keep it dry. Keep the stump dry. Avoid applying all sorts of things, all sort of substance on it, because when the umbilical stump is not dry as it should, the tendency of it falling off quickly will be low, right? Avoid applying close up and all sorts, right? Just ensure you have clean it with plain water and gentle clothes, soft, gentle clothes. And if you realize that urine or feces might have been deposited or it has come in contact with the umbilical stump, wash it off gently with water, keep it dry, pat dry afterwards, okay? And don't submerge the baby while bathing the baby in the bathtub. Reason is that because we are looking at keeping it dry. As long as the umbilical stump is still in situ, ensure that you sponge bath the child afterwards. Keep it clean and dry. And while wearing your baby's pampers or diaper, ensure that the umbilical stump is outside. Don't close it up with the diaper, because if you close it up with the diaper, the tendency of it coming close in contact with feces and urine will be high, and it could lead to infection and other complications, right? Again, don't apply um, methylated spirit. Yes, I know that methylated spirit has been in tradition or has been in use all the while, but current studies or current advice is that allow the umbilical stump to dry on its own, wash with water, keep it dry, keep it clean, keep it open. Air dry it, allow much air to fall on it or to hit it as much as possible. Again, allow it to fall off naturally. Don't pull it off. Don't be in a haste for it to fall out. Umbilical stump fallout might take up to 1 to 3 weeks, depending on the size of the umbilical stump. So don't be the one to pull it off. Even if it is hanging on a string, leave it there till it falls off on its own, and the end result will be it will be a healthy and clean belly button, right? And while at it, if you notice that there are signs of infection or abnormality in the on the umbilical stump or around the area, you need to take the child to a proper observation, okay? And what are the signs you need to look out for? You need to look out for signs of redness of the base of the stump. Yes, base of the stump. If the child frequently have fever, you need to look out for it. If there is foul smelling discharge that is coming out of the umbilical stump, you need to take medical intervention as soon as possible, okay? And if you realize that um, the umbilical stump has some things of blood or there's bleeding coming out from it, and hospital is not nearer to you, but you have access to getting an umbilical clamp, please don't remove the previous one that is already there. Rather, get another umbilical clamp it below it, leave it there. The reason is that while you might be thinking that it will be a heavy weight on the stump, the already existing clamp is there to constrict or to, yes, to constrict the blood vessels to avoid blood from coming out. And while you remove it, the tendency of it opening up is there, and there will be complication, or there will be issue of bleeding from the stump. Okay, so these are what you need to know while taking care of the umbilical stump of the child. And ensure that your hands are neat, your hands are clean while handling the umbilical stump. Okay, see you next in my next series, and do have a good day, right?